Hi friends, I am Dr. Pradeep. I want to tell you about the varieties of jaundice. So many know about the jaundice, but many don't know that how many varieties of jaundice are there. Actually, jaundice are many varieties in jaundice. So out of which I have selected some important varieties, up to 22 varieties and more than that also, because there are many viral infections also. Known viral infections are there, unknown viral infections are there. See all these things you will know. So important jaundice are, so this much of varieties. So initially I will tell you first main two types of jaundice, generally public what they say. One is white jaundice and one is yellow jaundice. So generally in jaundice everyone think that this yellow jaundice will be there. They will see the eyes, and if the eyes are yellow, then they will feel that it is a yellow jaundice. And some people see a patient in a white manner. If you see his eyes, then this eyes looks white. Then what is the cause of that whiteness in the jaundice? So they will have both whiteness and jaundice. So that is the white jaundice. So if this white jaundice, in medical terminology, it's called as hemolytic anemia. In hemolytic anemia, what happens? This RBC, red blood cells, will be damaged. So how they damaged? They will be damaged due to some of these diseases like sickle cell anemia. In sickle cell anemia, what happens? The RBC will be in a sickle shape. So it will be half moon. Okay. Actually, this RBC should be round one. Okay. It should be like a small plate, round one. So in this sickle cell anemia, RBC will become a sickle cell shape, and these RBC will be damaged within 10 to 15 days. So if the RBCs are going to damage early, then the patient will get anemia along with the jaundice. So this is called a white jaundice. Not only sickle cell anemia, so in this we have thalassemia, hereditary spherocytosis, and elliptocytosis, like this, and some other varieties also there. These are the important varieties. In thalassemia also one of the cause for the hemolytic anemia. So this is a white jaundice. Okay, and next comes to yellow jaundice. In yellow jaundice we have viral infection and bacterial infections. So in viral infections we have hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E, and some of other viral infections also, which till now we don't know. In the medical field also, then research is going on, further research is going on. Okay, and in bacterial infections, when a liver is infected with a bacteria, then it will give a liver abscess and severe pain, fever, and jaundice along with the infection of this bacteria. So generally I am telling all this for the superficial information of the varieties of jaundice only. So if you go to deep, then every jaundice variety will be a one separate video that we will see later. And in the meanwhile, if you not subscribe this Sims TV, just please subscribe. So I will be updating many important and routinely infections like jaundice, fever, anything. So in a simple way I will try to explain. So please try to subscribe this. And some blood transfusion reactions will also be there. So if you transfuse the blood to a person in an emergency, then if some reaction will occurs, then it will cause a blood transfusion reaction, so that they will get jaundice. And neonatal jaundice, newborns will be there. Newborns, they will get jaundice in the first 1 week or 10 days time. They will get neonatal jaundice. This is a common jaundice, but nothing to worry. If it is more than 10 only, then they need a phototherapy or consultation. Otherwise, no need of much intervention. So if you show the baby to sunlight, then it will be cured. And hematoma. So about this hematoma, if a person gets injury, if blood clots inside the abdomen or inside any hand or leg, then if that hematoma will be dissolved slowly, so that RBC will be damaged, and they will get the jaundice. This is jaundice due to hematoma. And now we have gene defects also: Dubin-Johnson syndrome, Crigler-Najjar syndrome, and Rotor syndrome. These three are gene mutation problems. This Dubin-Johnson syndrome, ABCC2 gene mutation, and this Crigler-Najjar syndrome is due to UGT1A1 gene defect, and Rotor syndrome is due to SLCO1B1 and SLCO1B3 genes defects. So these are the gene defect jaundice. And this Gilbert syndrome is also there. This is due to bacteria infection. So the person will get, if the person get bacterial infection, then they will get a GB syndrome. And biliary cirrhosis will be there. Biliary cirrhosis is when a person bile duct will be there. If bile duct is narrowed, then this is called the biliary cirrhosis jaundice. It will stop the bile juice to go into the intestines. Then it will cause the biliary cirrhosis and jaundice. Next, spirochetal infections, leptospirosis and syphilis. These are the common, and other spirochetal infections also there, but these are the common and important. So if these infections is caused, then obstruct the bile duct, and then it will cause the yellow jaundice. Next, cholangitis. In cholangitis, what happens? Liver, small ducts in the liver, so they will be damaged and they will get infected. They will be swollen. Then bilirubin, biliverdin. These both are the pigments, so they will come into the bloodstream directly and cause the jaundice. And this is the autoimmune hepatitis. Autoimmune hepatitis, what happens? Our own immunity will attack our own liver, so that they will get the jaundice. And lymphomas. Lymphomas are the cancers. What happens in lymphomas? WBC count will be increased and RBC count will be reduced, so that RBC will be damaged early, then they will get the jaundice. And choledochal cyst. Choledochal cyst is the cyst formed in the liver, and it slowly increases. Actually, this choledochal cyst will be started in the childhood only. Okay, so if that will be slowly grown and it upsets the bile duct, so that the patient will get jaundice, especially small kids. So it can be cured. And carcinoma of bile duct. If a patient get a cancer in the bile duct, then that will obstruct the bile duct and gives rise the jaundice. And acute liver failure. Acute liver failure may be due to alcohol intake, acute infections, due to old age also. Sometimes the acute liver failure will be there. Due to severe viral infections also, acute liver failure will be there. So it will also cause jaundice. And alcohol liver disease. Alcohol liver disease, when you take more excessive alcohol for many days, then the liver will be damaged and it will cause the alcoholic liver disease. It can be cured if the patient stop the alcohol intake. And liver cirrhosis. In liver cirrhosis, what happens? This liver will be shortened, and the natural cells of the liver will be damaged, and whole liver will be almost damaged. So this will cause the jaundice, and it will have surgery of only liver transplantation only. So if you transplant the liver, they will get the new liver. And if the patient stones in the liver or gallbladder, then it is called the cholelithiasis. So these stones will go into the bile duct and it will obstruct the bile juice and it will cause the jaundice. This is called the cholelithiasis. Cholecystitis. In gallbladder, if a patient gets infection, that is called cholecystitis, it will cause the jaundice and pain and fever. Pain in the hypogastric region, like this here. Okay. And in biliary stricture, this bile duct will be shortened and it will cause the jaundice. This is called the biliary stricture. Okay friends, these are the main important varieties of the jaundice. Generally, if a patient gets jaundice, people will be confused. It is a simple jaundice. It will go away like that. They will think, and some people are neglecting in these days. So, and they are taking some herbal medicines or like that. Okay, whatever may be the medicine, generally 90% of the jaundice will be cured as it is, because 90% of the jaundice will be due to viral infections or alcohol intake. And if the patient stops alcohol intake, this alcoholic liver disease will be cured, and viral infections will be limited 10-15 days or maximum 1 month or max 6 months also they will be cured. In case of hepatitis C, that will last for some people for 6 months also, and it will be cured. In some cases only it will be lifelong. If they take perfect treatment, then these chances of cure will be more. So dear friends, you have to approach a doctor, and you have to rule out the cause of the jaundice and take a good treatment. Okay friends, if anyone not subscribed, subscribe this my channel, Sims TV, for good updates and simple updates, and also you like the video. Thank you very much.